So when we look at the whole bone model, obviously we have the skull taken off of this. We can see that the main purpose of the vertebral column really has two purposes. One of those is to protect the spinal cord, and that's demonstrated here in this yellow color. And red are some blood features. And as you can see, the different shape, the distinct regions, we have the atlas and the axis at the top. And if we look at the shape, they're distinct from the rest of the cervical vertebrae. The first 7 are cervical. Then we have 12 thoracic. And then we have 5 lumbar. And you can remember that by thinking of mealtime: 7, 12, and 5. We also remember that there's a curvature. It's almost like an S curvature, first pointing outward or convexly, and then inward or concavely towards the stomach. Okay, and so consequently the vertebrae change to match that. In one of the other previous videos, we talked about the features of a general vertebra and the way to tell the difference between each of the vertebrae if you have just the individual vertebra. But don't forget, I could ask you a number for each section and ask you which type it is, and ask you to tell me how many of each of those total there are. Then obviously we have the sacrum right here, and then the coccyx, the tailbone, pointing down right here on the tip. And then next thing we're going to focus on, though, is actually on the parts of the thoracic cage. Okay, so each of these ribs are going to connect in right here to the vertebrae, and then on the front, on the anterior view, turn the model around, we're going to have the breastbone, which we call the sternum, and we're going to talk about a few of those features. Now we also will talk about the clavicles, the collarbones, and the shoulder blades. Turned around here. The scapula, right here, the scapulae, both of these. But we'll talk about those as part of the appendicular skeleton. All right, so first off, the ribs. We have 3 types of ribs. We have true ribs, floating ribs, and false ribs. And it all depends on whether these ribs are directly attached via their own cartilage to the sternum, to that breastbone, or they're connected via another cartilage, or they're connected not at all. Okay? And so true ribs are connected directly. We can see here, each of these near the top are true ribs. Down here, we actually share cartilage coming in, the costal cartilage coming in, and so those are false. And then right down here, we have 2 floating ribs. So there are 2 floating ribs. There are 5, or should I say 2 pairs of floating ribs. There are 5 pairs of false ribs. And then there are 7 pairs of true ribs. Okay? And then looking at the specific features of the sternum, of the breastbone, we have, first of all, the manubrium. So that's this top section right here, the manubrium. We have the body, this middle section, and then the xiphoid process, which is this lower section, the tip. And you can see these little lines in between each of those.